My name is Kelvin Mendoza. I'll be performing a knee trigger to a student at the SBCC radiology student. First of all, I'm going to set up my console. So I'm going to choose lower extremity, knee AP lateral. We keep it at 70, that's what I like. Ballpark range, 8 to 12, depending on the patient's size. We do mine at 8, leave it at 8 and see how the patient is, okay? Next, I'm going to check, but I think there it is. Okay, so this has IR there. I'm going to use the table bucky. We eventually bring up my table and bring this down, center it together, but I'll do that until the patient is here, okay? Okay, let me get my patient then. This little Para?
Yes.
Hey, Para.
Hi.
First and last name?
Lily Para,
Date of birth?
6492.
Okay, may check the wrist and really quick. Perfect, okay, that's you. Alright, ma'am, what brings you in today?
I took a fall on the step. I missed a step
In
in
where
the
does it hurt?
staircase, and then I hit here. I heard something pop.
Your left?
I'm sorry, my.
Your right knee?
Yeah.
Okay, so
Sorry,
right knee. So where does it hurt on? Right there?
Yeah, just right here.
Okay, and when was this?
Yesterday.
Yesterday?
Mm-hmm.
How much pain are you in?
On a scale of 1 to 10, about an 8.
An 8?
It
Okay,
hurts.
so it's kinda,
Yeah.
it hurts, okay.
Mm-hmm.
Any surgeries on any of the knees?
No.
Any surgeries in your lower extremities?
No.
No? Okay. So, any chance you might be pregnant?
No.
Okay. Alright, so, pull this down a little. I'm gonna have you lay back and.
Okay.
Okay. So, my patient is waiting there. Alright, ma'am, so I'm going to place some lead there, protect you. Bring my table up. Okay. I have you toes up, straight. Thank you. That's perfect. Okay. Keep that for me. Make sure it's at 40 inches. Okay. Make sure the tube is centered to the IR. So we're all good. Now I'm gonna look for my center ray, which will be ½ inch inferior to the apex of the patella. Okay. Okay. Perfect, man. So hold that position, okay? With my right marker. Okay. We're all ready. X-ray. Okay, so I'll come, take out my IR, replace it, read the previous one. Put new one in there. Okay. So for this one, man, I'm gonna ask you to put your toes together. Okay. So for my oblique, I'm doing a medial rotation, so 45-degree rotation for her knee, and we mostly do it by having their toes point each other. How are you doing, ma'am? You okay?
Yeah.
Okay. Central ray is going to be the same, ½ inch inferior to the apex of the patella. I've shielded her. We're still at 40 inches. We're lined up with that. I'm going to place my right marker. Okay. There is no tube angulation. It would be depending on distance from the ACES to the axis to the tabletop. Below 18, we'd give it a 5-degree angle cauted. Since she's normal, she seems about right in range, which is 19 to 24. I'm not gonna give her an angle. It's perpendicular. And if she's a little bigger, which would be above 25 centimeters, then I'd probably give her a 5 to 7 degree angle cephalic. Okay, So we're ready. Hold that, okay, man? Okay, X-ray. Okay, so then I'll take out my IR, switch it out, and put in the new one. Okay, man. For this one, I'm gonna ask you to rotate towards me. Okay. Keep your light. Actually, oh no, sorry. Keep it there. We're flexing this one. Okay. Perfect. Cover her. And the shield on there. 20 to 30 degrees knee flexion right here. Yeah, perfect. Thank you. So for my lateral, I'm gonna give her a 5 to 7 degree angle. There we go. And make sure this is lined up again. Okay, we're all lined up there. So now what I'm looking for is 1 inch distal to the medial epicondyle. There we go. Okay, she's shielded. That's my right marker. Okay, so still 40 inches, IR centered. Knee is back. Okay. So X-ray, and I will use my same technique for oblique and lateral 70 at 8 for her size. Okay. All right, ma'am. How you doing there?
Yeah, doing good.
We're just doing this 2 more. Okay.
Okay.
Okay. So then I would. Okay. So for one of our special views for the knee, we're looking for the intercondylar fossa. We use a clear method. My technique. My patient's small, so go 60 at, let's say, 4. A range of 4 to 6, depending on your patient's size, okay? There we go. So for this, we're going to give it some elevation. We're going to give the knee some elevation to decrease OID. Okay, ma'am, can you bend your knee? Okay. Put that in there. Have the knee flex about 30 degrees. 8 by 10 crosswise. Sorry, man. You're doing okay?
Yeah.
Okay. You shield her. Okay, so now we're going to match the tube angulation to her knee. And the central raise gives you the same 1/2 inch below the apex of the patella. Center to the long axis of the tip of the lower leg. Okay. There we go. Oh, we're actually right on point at 40, so. Okay, place my right marker on her lateral side. Okay, my muted okay?
Mm-hmm.
Okay, so hold that position for me, okay?
Okay.
So I would shoot the X-ray. X-ray. Okay. So now, and that's how we do the glare method. Okay, our last projection for the knee, we're gonna do for the so-called sunrise, or for the patella femoral joint. I'm using my technique of 70 at 5 mass. Okay. Hi, Matt. How you doing?
Good. How are you?
Good. Okay. Table over there. Can you scoot all as over here towards me as far as you can, please? How's your knee doing?
It's okay.
Okay, a little more, please. Perfect. And can you bend this knee, please? Okay. Okay, ma'am, you can lay down. Cover. Put my shield on. For this one, can you please hold this? Right. Is that okay?
Mhm.
Okay. Like two. I'm trying to go as low as possible I can, and then I'm going to angle it. Can you bend this knee? There it is. 15 to 20 degrees tube angulation depending on the flexion of the knee. And my central raise is going to be to the joint space between the patella and the femoral condyles. Okay, you actually see the shadow there. Okay, my patient has been shielded. Place my right marker on her lateral side so we don't see it in the image. Let me see my SID. Column it a little and just get the joint space right there. Okay, ma'am, hold that position for me, okay?
Mhm.
Okay, so then I come, X-ray. Okay. And then we're all done here. So then I run my last image, read it on the computer, check that all my images are good, and then I will come back to the room as the patient. Okay, ma'am, we're all done. Lower you down. So we're all done with the images. Your doctor should be getting them in the next 24 to 48 hours, and he will let you know the results.
Okay.
Okay?
Thank
Thank
you.
you very much. And that's how we do the knee. Okay, so evaluation for my images. It's a AP knee. So evidence of proper collimation. The knee fully extended. The entire knee without rotation. So we can see that because the femoral condyles are symmetric and the tibial antecondylar eminence is centered. Also slight superimposition of the fibular head with the tibia and the patella completely superimposed over the femur. Open femoral tibial joint space with equal distance between the two sides. And good soft tissue and bony trabecular detail. This is my lateral knee. The knee is flexed 20 to 30 degrees. The fibular head and the tibia are slightly superimposed. The patella is in the lateral side. Open patellofemoral joint space. And open joint space before the femoral condyles and the tibia. And good soft tissue and bony trabecular detail. For the medial oblique, we have the tibia and the fibula separated at their proximal intercalation, so right here. The posterior tibia, lateral condyles of the femur and the tibia, so lateral condyles. Both tibial plateaus on the tibia. The open knee joint right there. And the margin of the patella projecting slightly beyond the medial side of the femoral condyles right here. You see the patella. In good soft tissue and bony trabecular detail. My next one is the sunrise view. I use the Beclair method. So for this one, we have the open intercondylar fossa, the posterior inferior surface of femoral condyle, intercondylar eminence, any joint space, no superimposition of the fossa but apex of the patella, right here, and no rotation as demonstrated by a slight tibiofibular overlap, as well as good soft tissue and bony trabecular detail. Okay, and then for my patellofemoral joint, I use the Setagas method. So we have evidence of proper good culmination, the patellar profile, the femoral condyles, and the intercondylar sulcus. Open patellofemoral articulation right there, and good soft tissue and bony trabecular detail. That is my evaluation for the knee images.